Diastasis recti has been the hot topic in the prenatal and postpartum world. And so in an effort to kind of clear up some misunderstanding and give more information on this condition, I will be releasing a series of videos on DR. The first video is just going to go over what is diastasis recti and how is it measured. Diastasis recti is a condition that affects the core unit. However, this is not something that is specific to just the prenatal and postpartum population. Anyone can get a diastasis, male or female. However, for the purposes of the video today, I will be talking about diastasis recti in terms of pregnancy, because that is what I do here. So, diastasis recti is a condition that is characterized by the separation of the rectus abdominis at the linea alba. So the rectus abdominis are the six-pack abs, and the linea alba is the connective tissue that holds the two together. During pregnancy, the growth of the growing baby is going to press out on the abdominal wall, and this is going to cause the abdominals to stretch to accommodate the growth. This is perfectly natural and normal, and it has to happen because the baby has to go somewhere. However, the overstretching or the breakdown in functionality would be considered diastasis recti. Now, currently, diastasis recti is measured based off of finger width. So the clinical definition states that a 2-finger width separation or less is not diastasis recti, and anything greater than 2-finger width separation would be considered diastasis recti. So while I agree that we should be measuring the separation, diastasis recti is a condition that is far more complex than just width. So we're going to kind of go back a little bit and let's talk about the linea alba. The linea alba, the connective tissue or the fascia, is made up of 2 types of fibers: elastic fibers and collagen fibers. So because the linea alba does contain elastic fibers, this means that the linea alba should be able to stretch to a certain degree to accommodate the growth of the baby during pregnancy. And this is its function, that's perfectly normal. However, at the end of the day, the linea alba contains more collagen fibers. So really, this is a structure of support for the inner core unit. It starts at the base of the sternum and it goes all the way down into the pelvic floor. So if we have an overstretching or a loss of functionality during pregnancy, this is going to cause us to lose the tension and therefore the support of the linea alba. And this loss is going to affect the entire inner core unit. Another reason why I'm not a huge fan of just looking at width is because women are starting to check for this condition on their own. So if a woman at home does the self-test and sees that she only has a 2-finger width separation, she's going to think, okay, I'm good to go. I can do any exercise that I want. However, if she doesn't assess the health of the fascia or the function of her inner core unit, she could potentially make this separation greater over time. So besides width, we also have to assess depth. And so the depth is going to tell us the health of the fascia. It's going to tell us if there's tension in that linea alba. And if there's not, that's something that we need to address. Then we also have to look at the function of the inner core unit. Can the woman create tension? Can she control intra-abdominal pressure? If she can, wonderful. If she can't, that also needs to be addressed, because over time, as she continues to exercise, again, this condition could be worse. So the diastasis recti affects the inner core unit, and it will affect the entire inner core unit, all the way down to the pelvic floor. And so this is something that needs to be addressed more than just width. We have to look at functionality and health of the fascia. So I hope you guys found this video helpful. Please leave any questions or comments below, and be sure to subscribe for more videos like this.